and welcome to our 11th COVID Community Town Hall, sponsored by the Stanford School of Medicine, Office of Community Engagement, and the Department of Epidemiology and Population Health. My name is Lisa Goldman Rosas. I'm an assistant professor in the Department of Epidemiology and Population Health, and I direct our Office of Community Engagement, and I am so pleased to be your moderator today. Today is a really exciting day. We are going to focus on the pediatric vaccine rollout in our community. So for kids from 5 to 11, really our main goal today is to answer your questions about the vaccine for children ages 5 to 11. And of course, 12 to 18 as well, if you have those. And then also to discuss how we can get those vaccines effectively out to our whole community. And I want to make sure everybody knows this is a judgment-free zone. There's no question that's too general or too specific. We are really here to answer your questions. So please go ahead and use that Q&A button and start submitting your questions as the speakers and panelists are talking. Y como siempre, si quieren poner sus preguntas en español también, adelante. We will get to as many of the questions as we can and even try to answer some as we go. So we have a stellar lineup of panelists today. You can go to the next slide. Great. So I will introduce our panelists. You'll notice all our panelists are from Santa Clara County. We actually have another town hall from Stanford, from Pediatrics, just following this one for San Mateo County. So you can get lots of your specific questions answered. And I think someone will go ahead and put that link in the chat if you're interested in the next town hall. So let's go ahead and meet the speakers. So we have Dr. Marty Fenstersheib. He is our vaccine and testing officer for the County of Santa Clara Public Health Department. And Dr. Fenstersheib is a return visitor to our COVID town hall. So we're very happy to have him back. We have Dr. Galvez, who's a pediatrician and actually a hand surgeon, but he is a tremendous advocate for getting vaccines out to children, and we're so thankful to have him here. He's with Valley Children's Healthcare. And then we have two representatives from school health clinics of Santa Clara County. So we have Yeshe Mengesha and Dr. Claude Rogé, who's their medical director. And we're really thankful to them. They are actively getting vaccines out there as we speak. And just shortly, Dr. Bonnie Maldonado, so she's one of our experts here at Stanford. She's on another town hall now, but she will come and join this town hall shortly. She is our Senior Associate Dean for Faculty Development and Diversity. She's a professor of pediatrics and in the infectious disease division. And she has been a real expert for us throughout this whole process. I'm not sure how many times she's been on our town halls, but many, and we're very thankful to her. So if you've joined some of our past town halls, you know I always like to get to know the speakers a little bit better. So I ask them to answer one icebreaker question so we can get to know them. So today, since we're talking about elementary school age children, I am going to ask each of the speakers to share something about the elementary school that you attended or elementary schools that you may have attended. So I can go first. I attended elementary school here in Santa Clara County. I went to two elementary schools, Hoover Elementary and Walter Hayes. Here in Palo Alto, and remember them quite fondly. And my own son actually got to go to the same elementary school as me, which is kind of exciting. So I think without further delay, we're going to turn it over to Dr. Fenstersheib to get started. And don't forget to share your a little bit of information about where you went to elementary school, whatever you want to share.
I went to elementary school it was called James E. Rogers, and it's in Pittsburgh, Pennsylvania. It's still an elementary school, and I remember it fondly. In fact, I found a picture of my 5th grade class taken outside. Boy, I didn't look so good, but it was so much fun, and I was a crossing guard actually at my elementary school. So I used to help kids cross the street with the traffic lady. I really am very, very happy to be here today. I was introduced, I'm the former health officer of the county. I've come back, and after retirement to help out with COVID. And I'm really excited to be working on the rollout of the kid vaccines. I'm also a pediatrician. I was in practice for a short time and then went into public health soon thereafter. So this slide is a first slide just to warm you up, to show you a couple things. Basically, the bottom line on this slide is to say that if you are unvaccinated, you are 5 times more likely to come down with the COVID infection. So the rate of infections is about 5 in people who are fully vaccinated. It mean, you know, that also means that we still see infections in people that are vaccinated, breakthrough infections. But if you're not vaccinated, your rate is 5 times that at 25. So there is a tremendous benefit of having been vaccinated. Next slide. And a lot of times we get questions from parents or others to say, are children really at risk? You know, or I heard that children don't get COVID. Well, that's not the case. Children 5 to 11 are just as likely to get infected as adults. And we looked at national statistics, nearly 2 million kids nationwide have been infected, and it's probably much higher because a lot of those are probably not reported. We've had almost 100 children who have died of COVID, and thousands of children who have been hospitalized. A third of the 8,000 that have been hospitalized ended up in the ICU. And the rates of these infections and kids that don't do as well that are hospitalized are much higher in children of color, Hispanic, African American, Native American children also. And children can transmit COVID to each other and to adults. And long COVID, meaning that after they actually get over the illness, they still have symptoms that can linger on for many weeks or months. Next slide. Again, just quickly to look at some of the indirect impacts of the COVID pandemic on children. You know, it's been an emotional struggle for children. All last year, as you know, they weren't in school, haven't been able to see a lot of their family or their friends. The educational gaps have widened. They haven't been able to participate in as many activities. They've been gaining weight, as all of us have, not getting into their provider for their regular care and missing out on some of the routine childhood vaccinations. So, and they've also lost, you know, a lot of these children have lost caregivers, parents, and other relatives. So it's been a struggle. Next slide. So the eligibility for now with the new vaccine, we're so excited. So just for everyone to remember that it's here for children between 5 and 11 years of age, and you can get vaccinated, you know, pretty much all these kids can be vaccinated. We've had a lot of questions about, what about my child who has food allergies? It's okay. That's absolutely fine. Seasonal allergies, asthma, it's fine. What about kids who had been previously infected with COVID? Absolutely okay to be vaccinated. In fact, it's important to be vaccinated because some of the protection you get from the natural infection begins to go away more quickly, and getting that vaccine actually boosts up the natural immunity that you've developed from the infection. So it's a good thing. And then, of course, all children with underlying medical conditions such as diabetes, asthma. We had some questions about children with thyroid conditions. All of those children are going to benefit from the vaccine. Next slide. And this vaccine, it's the Pfizer vaccine. Only Pfizer is the one that's authorized for the children's vaccine. It's the same vaccine, but it comes in a smaller dose. It's a special, you can see the picture there of the orange vial. That's the children's formulation of the vaccine. It's just for children. It's 1/3 the strength, or 1/3 the dose of the adult formulation. The kids, though, still need the 2 doses like the adults, 3 weeks apart. And you're fully vaccinated after 2 weeks after you finish the last dose. The vaccine is very, very effective in preventing symptomatic disease. So it was tried and shown to be effective and safe. And you can give other vaccinations at the same time. So flu shots, we'd love everyone to get a flu shot. And if you want to get your flu shot and a COVID shot, you can have those done at the same time, along with other childhood vaccinations that need to be brought up to date. Next slide. The safety issues, the FDA, the Federal Drug Administration, really decided that the vaccine did meet the safety and efficacy standards for authorization in this age group. The clinical trials were conducted with actually over 3,000 kids, and they compared them with how well how effective it was in kids that were young adults 16 to 25. But millions of young adults and children 12 to 17 have received the same vaccine, and this is only a third of the dose. So we expect that perhaps some of the secondary side effects will be less. And this isn't the end of monitoring the safety. The FDA and the CDC really have committed to continue to monitor the safety of this vaccine for the next several years. So even though it's authorized right now, it will be continually evaluated for its safety. Next slide. Always the question about common side effects. And again, this vaccine, even for the kids, we will see common side effects. And most common, again, pain where you got the shot, some redness or swelling. You can apply some cool, wet washcloths to that area to make it go away, move it around. There's also some symptoms that we have seen in kids that beyond just the sore arm, including headaches and sometimes muscle aches, chills, low-grade fever, even nausea. These things will go away in 1 to 2 days. Kids should drink plenty of liquids, and you can take over-the-counter medications to get rid of the pain or the fever. We don't recommend aspirin in this situation. Next slide. And many locations have lots of availability for vaccinations. We've reached out to the healthcare providers, the large ones, Kaiser, HAMF, El Camino, Stanford. Everyone has a vaccine, and they're going to start rolling it out very quickly. Private doctors, we are redistributing vaccine to private pediatricians, but not all of them. Some of them will have it. You need to check with your private doctor if you want to make sure, if you want to go in to see that doctor to be vaccinated. We have a number of school sites, and we are actually today doing 5 different school sites in Santa Clara County. I just came from the first school site, and it was just very exciting to see the parents and the kids. The kids did very well, all very brave. Retail pharmacies will have vaccine. You have to make sure they call for the ones that you want to go to for their availability. And then for county locations, and all are welcome, you can look us up at sccfreevax.org and make an appointment or stop by at one of our drop-in sites. And then the community clinics, which we will hear more from today, will also have vaccination opportunities. Next slide. Just a quick mention about the boosters, because our vaccine clinics will provide booster shots for adults at the same time. If parents want to bring their children and also get themselves a booster, you can, if you're 65 and older, or have an underlying medical condition, or working in a high-risk situation and are 6 months out from your end of your primary series, you can get a booster. And we have all 3 vaccines for you to choose from. Next slide. And again, as you can mix and match these vaccines, you can make the choice as to what vaccine you would like for your booster shot. Next slide. Again, the Pfizer vaccine is the only vaccine that has now been authorized for the kids for 5 and older. And you can see that Pfizer is the one that actually is available for the largest age group. The others are have been authorized for 18 and older, Johnson & Johnson and Moderna. And they will be over time submitting additional data to the FDA so that they can also get authorization for younger age groups. But again, not yet. Just Pfizer is available right now. Next slide. And again, just some county information available by phone and language access. So you can look up any of those various sites to get information in any of those languages that you might need. You can also call 211 for general COVID information. I think that might, oh no, I have one more, I think. Yes, I always end my talks on whatever I'm talking about with a plug to get, oh, that's my 10 minutes on my clock. The plug for flu vaccination, please make sure you get vaccinated. Now's the best time to get vaccinated for flu, and anyone over 6 months of age is eligible. I'll end there. Thank you very much.
Wonderful. Thank you so much, Dr. Fenstersheib. This is just great. Really great for setting the stage. So we're going to pass it to Dr. Galvez next.
Thank you for having me. So I am from the Bay Area, and so I actually grew up in San Francisco initially as a kid, but went to high school in the East Bay in Walnut Creek, and I went to Bancroft Elementary. And I just have a lot of fond memories of being a kid. And it's crazy how you can, in your mind, see the playground and walk around, at least for me, like see exactly where you were as a kid. And I can just kind of go back to that in a second. And so I've worked a lot with kids. I'm a pediatric hand surgeon in the Central Valley, both with mentorship with kids in middle school and elementary school, and up to the teenage years as well. And so I don't have a deck or a PowerPoint, but I really just wanted to share kind of my perspective. We're all part of the state of California, right? I got trained at Stanford for 11 years, and I'm here in the Central Valley in Fresno. But the pandemic, as we know, has been very significant, and it's just what was just mentioned. There's all these secondary effects that happen when the population gets sick. It affects children, right? When a parent gets ill or even dies, right? That's affecting a family and a child. And so, we've had our hospital at Valley Children's, we've had significant patients that have had COVID-19. For myself, they've mostly been related to, having other injuries such as trauma that I've taken care of. But there have been, even the first reported death was here in the Central Valley. And so just as was mentioned, there's these differences between where you come from, what your socioeconomic background is, what your ethnicity is, and that determines your outcome. And so that's why these efforts to promote science, to promote vaccines become so important. The other part that we've seen has been just delays in care with children, right? If you have a hospital that's overrun, if you're lacking resources secondary to the pandemic, secondary to all those aspects, it results in delaying care for children, both medical and surgical. And so I think a reason I was invited here is I'm very active on social media, mostly on Instagram. And I talk mostly about mentorship because there's an incredibly low amount of Latino physicians in the Bay Area, and even down here in the Central Valley. And so that is definitely a part that I think is part of this solution now and into the future, is you really want to think of it as diversity drives excellence. And really what that implies is that you want your physician and other health providers to reflect your community. And I think that's where you build trust as well. And so I can tell you, I'm a hand surgeon. I'm a pediatric hand surgeon. I'm in a very subspecialized, very complex field, but I have this conversation with my patients. I ask them, have you been vaccinated? To the teenagers, at least. Now I'm going to be asking 5-year-olds, have you been vaccinated? Which I think is pretty funny. They can be like, what? No, I don't want a shot. But it's part of my practice. I'm a hand surgeon, but it's important that the community is aware. And I can tell you many times I have families that tell me I'm the first Latino or Latino physician they have ever met. And that's the problem of our healthcare system, right? How are they meeting someone who is super subspecialized, who took 21 years to get to this point? How am I the first Latino physician that they're meeting? And so that is where the trust of the community becomes so important, because you definitely want to have these frank discussions with families. And so they asked me, like, should I get vaccinated? And I'm like, no one's told you? Yes, please get vaccinated. And then that makes the difference. I'm a hand surgeon, but just that level of trust of me talking in Spanish, knocking on the door, saying, I'm vaccinated, I'm going to get my children vaccinated. I think that's all important. And so I've been very vocal on social media. Most of it is geared towards pre-medical students interested in medicine. But I really appreciate what Stanford has been doing with this venue. And I think it's really important to allow a place where there can be questions. Some of it has to be, in person there, in the trenches. But I do think this gives a really good place for patients and families to ask those important questions, like, should I have my child vaccinated? And every physician, right, is going to be like, yes, please, like, this is going to help prevent disease for you, prevent spread with low risks. And it's a decision the family has to make, right? Whether this is something that they want for their child. And I think the more that we share our stories, the more personal that we get, the more effective we can be with conveying and having a connection and saying, oh, I came in from a hand fracture, but Dr. Galvez said for me to get vaccinated. So now, here I am, and I'm going to get vaccinated because I think it's good for me and I think it's good for my family. That's how you get buy-in. That's all I have, honestly.
Dr. Galvez, thank you so much for sharing that story. I think it's incredibly important, and I hope everybody has a chance to meet you. We're going to turn it now to Yeshe Mengesha and to Dr. Claude Rogé, who are from the school health clinics in Santa Clara County.
Dr. Rogé, you want to start first?
So first of all, I went to grammar school in France, and it was an all-boys school. And of course, it was a big change when I went to a mixed school, and I will always remember that. But I had a good experience in grammar school. Anyway, I'm going to introduce very briefly the school health clinics of Santa Clara County, because we are available to give vaccines in 6 of our sites. And we just want to let you know who we are and what we do. We were started by school nurses in 1986, and they saw that lots of children in the school did not have primary care physicians. And so they got a grant to do this, and they started at the San Jose High School, then went to the Overfeld High School, and eventually to multiple schools into the Bay Area. Eventually, the organization became what we call a federally qualified health clinics. And that means that we are providing care all year round. We are providing care to all ages and people in the communities around our clinics. So I just want to show you maybe the next slide, Yeshe, where our locations are. You can see we have 5 clinics in San Jose, and we have 1 clinic in Gilroy. And I just want you to know that today we started giving the COVID vaccine in our clinics, but I just want you to know that anyone interested on Friday, we will have a vaccination open to the public at the Garden Alameda Neighborhood Health Clinic. And that will be starting at 2 o'clock and going at until 6. And anyone can come in. Of course, we are focusing on the children, but if parents need a booster or need to start their vaccine, we can do that as well. So the next slide shows that, we are a small organization. We have 6 clinics, but the clinics, 2 of them have 2 providers at the time and 3 medical assistants, but the other one have 1 provider and 1 medical assistant. But as soon as the pandemic started in March, we started testing our patients, of course. At first, the turnaround time was so long that we often sent patients to other places where it was quicker. But now our turnaround time is reasonable, so we are doing screening. And you can see that we had a peak in December and January. In red, you have the positive cases. So you see in December, we had 71 positive out of 200 and 61. So that's a pretty high positivity rate of around 27%. Now, we tested lots of people the last several months as well, but you can see the red is very small. The positivity rate now is much lower. So the second more patients that we tested was actually in September 2021, 246, but we had only 10 positive, which gives a positivity rate around 4%. So, and the next slide, this is in part due to the fact that the county as a whole has done a great job at providing vaccination to the people in Santa Clara County. And these are the overall numbers. If you take only the people 12 years and above, 85%, more than 85% have been vaccinated. And if you take now people of all ages, is only 73%. Now, epidemiologists can make a precision about that, but what you hear is that to really reach what we call herd immunity, where everyone is protected, you need about 85%. So there is still some work to do. Now, as an organization, we started as soon as the vaccines became available. We started by doing mass vaccination with another organization called Roots, and this was for all ages. I mean, not all ages at the time, it was only 18 and above. And we did administer over 11,000 doses in that context. Then when the vaccines became available for 12 years old and older, we started doing in our clinics. And actually today, we reach about 700 doses that we have been given in our clinics. And we also started giving the boosters when that became available. And we can give both the Pfizer and the Moderna vaccine. So Yeshe, I don't know if you want to add anything to this.
Yeah, I mean, we are open to vaccinate the children from 5 to 11. We are in school ground. We invite everyone to come into the clinics and get their vaccines. Friday, tomorrow, we are open till 6 p.m. So it's walk-ins if anybody wants to come to the Garden Alameda Clinic and get their vaccines from 5 and above.
Okay, I don't know if there is, okay. So just a few pictures of the, that was a mass vaccination. And I want to thank many volunteers who helped us, people from Stanford and people from UCSF came to help us. So we are very thankful that they made it possible. Thank you.
Wonderful. Thank you so much. Well, let's see. Let's get to a few of the questions while we wait for Dr. Maldonado to get here. So I have one question. I think I'll pass it perhaps to you, Dr. Fenstersheib, to start. Let's see. This one was, I have concerns about the vaccine and if it will have any effect on the development of children who haven't gone through puberty yet, so prepubescent children. Can any of the panelists speak to that, taking into account how long vaccines are usually reviewed for children in this age range? Are there any assurances they can provide parents that this vaccine will not have a negative impact on physical development for children in this age group? Sorry to give you the hardest question first.
Oh, again, first of all, I think that people get a little nervous when they hear that these are mRNA vaccines, like it's something new. It's not something new. It's been researched and used in development for many, many, many years. So I think the technology is a good one. We have seen in the trials so far that the vaccines in the limited trials that they did were safe and effective. And again, we also have been giving these vaccines to the 12 and olders now since May, and there's been several 100,000 to millions of vaccines that have been given, and these kids have all done well. I think there is no I haven't seen any scientific discussion or issues around anything revolving around childhood development. There appears to be, no link or no worry in that age, in the early childhood developing years. And there's no reason to believe that this vaccine, like any other vaccines, because we use a lot of other vaccines. Just think of all the vaccines that the young children get as they're growing up. And none of them have had any negative or detrimental effects. And there's no reason to believe that this one would be any different than those others.
Thanks so much. I don't know, Dr. Galvez or Dr. Rogé, if you want to add anything to that answer.
No, I agree with Dr. Fenstersheib, but the bottom line is that also we don't have the data yet because the numbers are fairly small. So again, we haven't seen anything wrong in that developmental aspect, and we haven't seen it. Definitely, we have more experience with the 12 and older, and we haven't seen anything along that line. So I think all that is reassuring.
Absolutely. Dr. Galvez, did you want to add anything, or should I get to the next question?
No, just I agree with what's been stated.
Great. But wonderful question. I think it is so important to get all of your questions answered so you can make a good decision for yourself and for your children. So thank you for that question. Here's another really good question. So my daughter tested positive for COVID at the beginning of October, so about a month ago. When is it safe for her to get her vaccine? I could pass it to any of you. Dr. Rogé, you look ready.
No, Dr. Marty, you go, because that's
okay. Dr. Fenstersheib.
Yeah, the CDC just released a whole list of clinical considerations, in fact, today, and very emphatic discussion about that. And your child can be vaccinated as soon as they get over their infection. So it's been, I'm assuming they are, and I'm sorry that your child got infected in the first place, but they will benefit from getting vaccinated so that their immunity is even boosted. So usually like 10 days after their diagnosis, if they go through any of the symptomatic phases, but as soon as they're out of isolation and back into circulation, they can go ahead and get vaccinated. They do not need to wait any specific time past that, and they will certainly benefit. And I hope your child has done well and is over the infection at this point.
Absolutely. Great. And there's another question we have about the data for getting multiple vaccines at one time. And Dr. Fenstersheib, I know you said children get many vaccines. We have a lot of experience doing this. Usually our young ones get multiple at one time. Can you share anything about data on safety for getting multiple vaccines at a time, like flu and COVID?
Yes, and again, in those clinical considerations that came out from the Centers for Disease Control, there is no reason not to be able to get multiple vaccines using COVID. So early on, you may have heard originally we were not sure because they didn't have the data yet. So there were some questions whether kids could get 2 vaccines at once, flu, or there was any period of time that you had to wait. But I'm very confident right now that when your child goes in to get the COVID, they could also get the flu. And they said they could also get any of the other vaccines that they may be needing to be up to date with their childhood immunization. So, I know it's multiple shots for kids is never fun, but sometimes it's good to get it over with so you don't have to come back and face it. But yes, you can do multiple different vaccines along with the COVID vaccine. Just put them usually in different arms.
Yeah.
Thank you. Go ahead. Yes.
Well, no, we have done this in our clinics. So, all type of vaccines. Now we are focusing on the flu, but HPV, any vaccine that they are due, we try to catch up at the same time, and we haven't seen any special problems.
Wonderful. Well, I see Dr. Oh, go ahead, Dr.
Oh, I just wanted to state something that, there's always very good questions, just like you mentioned, about what will the long-term effects be, right, of the vaccine. And just like what was mentioned, we know a lot of it based on data from adults, more about teenagers, and we're going to get more information about younger children. But the part that I think should always be mentioned at the same time is we still have a prevalence of COVID-19 within our community, right? And so that is really and that's what I tell families too, is, you're deciding, it's not a great decision, right? And meaning it's a hard decision, really a decision to do nothing and be protected from all, right, is not possible, right, as we re-enter into society. And so we have two decisions, in my opinion. It's one, it's have your child or a family exposed to COVID-19 and get COVID-19 and have the risk of long COVID symptoms, something that could very much happen, the morbidity of what can happen. Or the other option is the vaccine, right? Which as we're talking about, we know and we think is very, very safe. And so I think that's frequently how at least for me, I try to frame it, because we're in a hard place where we still have prevalence, where we do have, I know of a child, there's children all the time that are getting COVID-19 here still. And so it is happening. And so if you have the opportunity to protect your child and protect your family, that is, I think that's something just to really consider for you and your family.
Thank you so much, Dr. Galvez. And I see Dr. Maldonado joined us, and I know she always reminds us that in addition to the COVID vaccine, we need to be up to date on all of our vaccines. So Dr. Maldonado, why don't I pass it over to you to say a few words, take your time, and then we'll get back to the questions.
Great, thank you. I'm so sorry I jumped in later. I was on another town hall with the American Academy of Pediatrics. So we have town halls every 2 weeks. And right now, we were going over with our pediatricians, our 67, not all 67,000, but all of our pediatricians about how to talk to parents about the new vote that we just took this last week on the vaccines for the 5 to 11-year-old. I went to a lot of elementary schools. We moved a lot when I was young. And of course, once I came from a first-gen family, we moved. I actually lived in Mexico for part of my life, so I had to jump back in and out of school a couple times. And then we bought a house in Southern California. We lived in Southern California. So I have my dad still lives in that same house now that we bought when I started 5th grade. So so I have a lot of friends who I met before I went to high school, and we try to still have little mini reunions. I won't tell you how many years they've been, but I still meet up with my friends.
That's awesome. All right,
Great.
Go ahead.
All right, well, I'm just gonna give you a couple of minutes of about maybe 10, 15 minutes just to go over some of the data. I don't know, Marty or others, if you did some of this, but I think I sent you some of these and I pared them down to just hit the highlights. Just so you know, I am a pediatrician. I'm an infectious disease vaccinologist. I work primarily in global child health, but also have worked on a lot of public health research here at Stanford. I trained at Stanford, Johns Hopkins, and also at CDC before I got my faculty position here. And the chair of the committee on the Red Book committee that's up there on my shelf here, the Committee on Infectious Diseases, and I've been really the chair now for 4 years. I'll be rotating off next year. So we've been doing a lot of this work on COVID, and I'm a liaison to the CDC ACIP. So been very involved with all of that. So if you look at the data overall, you can see that a lot of this is data from CDC or FDA. This is a COVID data tracker that anybody can just take a look at if you want to know what's going on. And you can see as of a couple days ago that there have been 46 million cases in the US with almost 750,000 deaths. But on the plus side, we've seen almost 80% of people 12 and older with at least one vaccination. And community transmission, believe it or not, is still considered high throughout the country. But if you look at the story around vaccines, we know that they protect against hospitalizations and death. and they prevent infection and transmission to others. And you can see here on the left, if you look at the the number of COVID cases in the US for the last, since the beginning of the year, by vaccination status, the line in black, which goes up, is the number of COVID cases, not hospitalizations, but cases among the unvaccinated. And the line in blue is the number of COVID cases among fully vaccinated people. So we do see breakthrough cases in vaccinated individuals because no vaccine is 100% effective, but the risk of cases is 6 times higher in unvaccinated people, and the risk of dying from COVID is 11 times higher among unvaccinated people. And you can see here on the right, hospitalization rates among unvaccinated in blue are much higher than those for vaccinated people. So even in, for example, in some countries where we're seeing some surges, what we're seeing is that if there's highly vaccinated populations, even if there are breakthrough cases, they are much less likely to lead to hospitalization and death. Now in children, we know that I'm going to focus on 5 to 11-year-olds because this is the new vaccine vote that was just taken this week, and the decision was made yesterday to be able to allow children 5 to 11 to be vaccinated. They are just as likely to be infected as adults. There have been almost 2 million cases reported in 5 to 11-year-olds, and they are less likely to be reported as cases. So that may be an underestimate because kids get runny noses and symptoms like that all the time and may be less likely to be brought in for a COVID test. We know that since the beginning of the pandemic, over 8,300 children have been 5 to 11 years of age have been hospitalized. In fact, if you look at children overall, there have been over 25,000 hospitalizations in just the 24 states in the US that actually report by age. And this is a level that is similar to what we see for influenza before the pandemic. And we have seen, excuse me, serious disease, including ICU admissions. In fact, this week we've had 5 kids admitted to the ICU. To Dr. Galvez's point, we've seen 5 kids admitted to the ICU this week here at Stanford, even though we think we're seeing a reduction in cases overall. And about a third of children in this 5 to 11-year-old age group will require ICU admission when they're admitted to the hospital. We know that there's a syndrome called multi-inflammatory syndrome of children, and that there are about 3,000 cases reported in the US. It's most frequent in the 5 to 11-year-olds, and about 3/4 of those children need rapid admission to the ICU to resolve their symptoms. So those are really important issues to remember from a clinical and epidemiologic standpoint. And if we look at COVID in the context of hospitalizations per year compared to other diseases for which we vaccinate kids, you can see that when we compare to hepatitis A, chickenpox, and influenza, the hospitalization rate for COVID is similar to or equal to or higher, and for those diseases for which we recommend vaccines already. And when we look at deaths in this age group from vaccine preventable diseases, we see that the deaths from COVID in this age group, which is, as you know, unvaccinated so far, exceeds the rate of deaths from diseases that for which we already vaccinate. So we know that there's a compelling case to vaccinate children. Since August alone of this year, we've seen over 2,300 schools closed across the US with 1.2 million children affected. And you can see the areas of the country that have been primarily affected in the darker shading there. And you can see those are states that primarily have low rates of overall vaccination. And we know that if you model the impact of COVID in children in this age group, if these children were vaccinated, it would accelerate the reduction of cases across populations by about 8%. So it's not the main reason. Some people have said that we are trying to vaccinate children to prevent disease in adults. And we do think that that's a secondary impact, but it's not the main one. I just showed you that children can get sick themselves and get very sick But it would also help overall the community reduction in COVID. We also know that there are indirect impacts, and these are all published data. I won't go through the papers, but there are data showing that children during the pandemic have faced worsening mental and emotional health. This has been itself a pandemic in this country and around the world. Children are having mental health crises like we've never seen. Widening of existing education gaps and health disparities in that area, decreased physical activity and increased body mass index, decreased healthcare utilization, decreased routine immunizations. Lisa, to your point, we've seen a reduction of or missing about 11 million doses of vaccines to children because during the shutdowns and the inability for practices to be able to keep up with children's child visits, that we're missing millions of vaccinations for measles, diphtheria, pertussis, tetanus, and other vaccine preventable diseases, and we want to avoid outbreaks of those as well. We've seen increase in adverse childhood experience and loss of caregivers. So I won't go through all the details of the study, but these were over 3,000 children who were vaccinated with the Pfizer vaccine in the 5 to 11-year-old age group. And by full disclosure, I was the Stanford investigator for the study here that we did here in the Bay Area. And we saw an efficacy of almost 91%. And there were 3 COVID cases among the vaccinated children in the study period compared to 16 cases in the placebo recipients. And there were very few serious adverse events. None of them were related to vaccination. And there were local and systemic reactions that were more common in the vaccine compared to the placebo recipients. In just under 3% of the children reported them. So again, here's the data that we saw 3 cases in the vaccine arm compared to 16 in the placebo arm. And so I think the reactogenicity or the side effects include local reactions such as redness, swelling, and pain at the injection site. And then systemic reactions included fever, nausea, vomiting, headache, fatigue, and chills. These were similar to what was found in adults, but notably, the number of reactions in children was lower in this age group than for older children and adults. And these were the serious adverse events. There were no deaths, fortunately, but the adverse events were related to accidents, so limb fracture, and this was actually related to accidents in the placebo group. So nothing related to the vaccine itself. And if you look at the overall estimated benefits for every million children in this age group, you can see on that the number of cases that are averted using the highest peak level of cases that we've seen in kids versus the average over the entire pandemic, we would, for every million doses, we would prevent between 18 and almost 60,000 cases with prevention of between 80 and 226 hospitalizations, of which a number of those, about 25 to 70 or so would be ICU admissions. And we could prevent between 42 and 132 cases of serious MIS-C disease. And so I wanted to talk a little bit about the myocarditis, which we've seen, and you can see here on the left, there is a risk of myocarditis at about the rate of 69 cases at the highest rate for 16-year-old boys after the second dose for every million doses administered. So really we're talking about 6 dozen cases per million doses. And on the right, you see a presentation of myocarditis outcomes by type of myocarditis. And you see here, this is classic myocarditis caused by bacteria and viruses not related to COVID. And this is the time for resolution of symptoms. So these are children who are out, still 30% still have symptoms 25 days after they've developed myocarditis. Whereas with COVID disease, at 25 days, you see about 90 to 95% resolution of symptoms. But from the vaccine, you see, first of all, very few cases, as I mentioned, but those cases in the green here resolve, virtually 100% resolve within 5 days. And these children, if they're hospitalized, have about an average stay of about 2 days in the hospital. So in summary, since the beginning of the pandemic among 5 to 11-year-olds, we've seen almost 2 million cases of COVID with 8,300 hospitalizations, over 2,000 MIS-C cases, almost 100 deaths. And we now know that COVID-19 is a vaccine preventable illness in these children. So thanks. And I'm happy to go back and join the group and answer questions.
Wonderful. Thank you so much, Dr. Maldonado. So I see a question in the Q&A that I really like. So it says, for each of you with children, what helped you to make the decision to vaccinate your kids? What kinds of questions did you have before deciding? And actually, the question that I have a 12-year-old boy. The question I had is related to a couple of the other questions I also see in the Q&A. And it has to do with their age and maturity, I guess. So I feel very lucky. I can call up faculty in Bonnie's department and ask them my questions. And that's why we're here today, to have you have that same kind of access. So somebody asked, if my daughter is 11, does it matter that she takes the lower dose versus what a 12-year-old takes at the adult level? And then we had one other person who asked a question again about the dosage and the age, because I think the 11-12 cutoff feels arbitrary to many parents, including myself. And another attendee says, I heard from a trusted source that the pediatric dose is not exactly based on chronological age. Now somebody just took away the question. I can't read it anymore. Not based on chronological age, but their immunological age. And so how are we to understand the dosing and the age groups? So I'm not sure, Dr. Maldonado, if that's best for you to start.
Yeah, let me just say that vaccine studies are, this is a standard approach to vaccine trials. And I've really never been involved with an industry-sponsored vaccine study before, but I really wanted to be part of the process and see how the company ran the study. I wanted to see how it was handled and how we could handle that locally. And I have to tell you that we had thousands of people. We didn't advertise. We had thousands of people sign up to be part of the study. The company was extremely transparent with the procedures and very much in line with all of other vaccine trials that we've done in the past. But really, the way companies pick ages is not, as you said, it's a continuum. So we do know that the immune system ages over time, but there are no specific cutoffs that, if you're 4 years and 364 days old, your immune system doesn't magically change the next day when you turn 5. But at some point you do have to cut off a study and you have to give yourself some kind of frame, guardrails. So what happened with the original studies, remember, we were really trying to get people vaccinated a year ago when this virus was rampaging with no vaccine in sight. And the companies decided to pick particular age groups. For Moderna, the age groups were 18 and older, and now they're looking at younger children. Whereas with Pfizer, they started off with 18 and then they moved quickly to 16. They have full FDA approval for 16 and older, but they have 12 to 15-year-olds. They have emergency use, and for the 5 to 11-year-olds now we have emergency use as well. But those were the ages that they picked. And what they saw in the original trials of the 12 to 15-year-olds was that they were giving them the 30 microgram dose because that's what was being done very early on during the pandemic. And with the 5 to 11-year-olds, we had a little more time to think about the dosing. And we were also concerned that younger children are more likely just in general to have fevers. So if you look at the old literature around fevers by age, we know that the younger a child is, the more likely they are to develop fevers and higher fevers than older children for any infection, not just for COVID. So fever and other side effects were really highly considered here. And it turns out that when you use the dose that is given to the 12 and older, the children in the studies 5 to 11-year-old children in the studies were more likely to have higher fevers. So it was thought that it would be best to use a lower dose for the studies and see if the lower doses of the vaccine could give you the same immune response and potentially the same effectiveness. And it turns out that that was correct. Now, if that hadn't been the case, there might have been some decisions about, well, should we move up to a 20, instead of, so the adult vaccine is 30 micrograms. The 5 to 11-year-old is 10 micrograms, but there was also an intermediate of 20 micrograms. So the question is, would we have moved up to 20 if the 10 microgram didn't work? But it did work. It was actually, children did get some low-grade fevers, but they were actually less likely to have that than the older kids with the higher dose vaccine. And they were also, their antibody responses were identical. They were what we call non-inferior. And we know that the vaccine was efficacious. That is, it was significantly likely to reduce infections, symptomatic infections compared to placebo. So to answer the specific question, and this has come up a lot, in fact, on the last town hall, many people asked the same question. If you start off at 11, what we generally do with vaccines is we give them by age. So it's always age-based, not weight-based or height-based, because it is about your immune system. And generally your immune system is more robust over time. But sometimes younger kids can also develop high levels of immune responses comparable to adults for some antigens. And in this case, what we are recommending that if kids are 11 for their first dose, they get the 10 micrograms, the 5 to 11 dose. If they turn 12 in time for their second dose, they should get the dose that is given to the 12-year-olds, which is the higher dose. But if by mistake they get the lower dose, that's okay too. It's just that we try to stick to an age-based approach.
That's very helpful. Thank you, Dr. Maldonado. I know my son turned 12 2 weeks ago, so he was right on the cusp. It was a hard decision to make, but it was helpful to have access to information. So I want to do another question about the safety. I thought this was a great question. So I have friends who are physicians themselves that are worried about what the vaccine could be affecting children in developing stage. And we had a question about this before you got here, Dr. Maldonado, as well, about children being still developing. I'm curious why there have been so much concern, even if FDA and CDC have approved the vaccines. I'm not sure if you want to do that one again.
Yeah, sure. I mean, I don't know what others said before, but we have to remember that when any vaccine new vaccine is rolled out, people always have concerns, and that's normal. I have 3 kids, my kids are adults, and they didn't ask me. They went out and got vaccinated. I mean, they probably knew what I'd say, but they are adults, so they got vaccinated right away as soon as they were eligible. But people have questions. They want to know, wait, what is this disease you're talking about? How likely am I to get it? What's the downstream impact of the disease? What is the vaccine like? What are the side effects? So those are natural questions. And I think everybody asks those questions, especially with a virus we've never seen on this planet until almost 2 years ago. So it's natural to have those questions. I do think that the way you look at these vaccines, we know that the FDA and the CDC have the most intensive surveillance and safety reviews of any government agencies in the world. And we know that both the mRNA platforms, which are the basis for the Pfizer and Moderna vaccines, and the adenovirus vector platform, which is used for the Johnson & Johnson vaccine, have been well established. They've been reviewed thoroughly over the many decades actually now by the FDA. In fact, people don't know this probably generally, but the mRNA platform has been used in different studies in humans for at least 30 years now. But there was never really any vaccine that people really thought they wanted to switch from their existing platform. So this was an opportunity to use a very safe and effective platform, a vaccine for a new disease. And these have been studied. They've looked at the way they function. I do have I didn't put them up today, but These viruses, the mRNA vaccines, especially the one for children, those don't involve animal cells, human cells. These are completely synthetic, small pieces of RNA, of nucleic acid, that serve as templates for the body's ability to produce what looks like the spike protein of the virus, but it's not from the virus, it's from the human body making a protein that looks like it. And then the body can then make an immune response to that spike protein. And the mRNA itself, it disintegrates immediately. It doesn't get incorporated into your DNA. It doesn't stay in your body. It's completely disintegrated. In fact, it was originally so unstable and easy to disintegrate that we had to put it in ultra freezers in order to keep it stable. So it is administered, it does its job right away, and within minutes, it really does get absorbed and excreted.
So I think what the panelists said before is there hasn't been any concerns about any effect on development of children as a result of the vaccine. And it sounds like what you're saying is the way the vaccine acts in our body, it doesn't stick around long enough to impact the development of children. Is that what we're hearing?
Yes, that's right.
Great. So I'm going to switch gears just a little bit. And Dr. Fenstersheib, we have some questions about how to get access to these vaccine appointments. So I've had a lot of questions coming my way today. How can I get an appointment? And people saying they're going like hotcakes. So what should people do about getting an appointment?
I think it's really important to know that we're not going to have, hopefully, as we're told, an issue with vaccine shortage like we had with the rollout of the adult vaccines. The federal government purchased sufficient vaccine for every child in this country. There are 28 million children, 5 to 11 in this country, and they purchased more than enough, including the second doses. So that vaccine is beginning to roll out. We actually had the opportunity to pre-order the vaccine before it was even authorized. So we pre-positioned vaccine. So that's why these clinics have started up even before, once the authorization came, basically the next morning, the vaccine clinics were up and running. The clinics, again, we have many providers that we wanted to make sure were out there that could provide the vaccine. So lots of opportunities for parents. So again, we've talked to Kaiser, we've talked to PAMF, we've talked to Stanford, of course, and everybody is ready to go, some a little bit sooner than others. So with some of those providers, you may have to wait a little bit longer. The county system was, we decided to get up and running right away. Our vaccine clinics are open to all children in that age range, no matter where you are receiving your care. So if you go to our website, which is sccfreevax.org, you can see exactly what's available. We have some walk-in clinics and other clinics. Now, as I mentioned, the school clinics also are been booked, and we had our first several of them run today, and over 80 of those clinics will be occurring in schools. Dr. Rogé and his team will be having those clinics in their schools also, in the school-based programs, and pharmacies also in our county have received around 11,000 doses of vaccine so far. So we have in our county about 75,000 doses on hand to be able to provide to the families. And if you are not seeing appointments today, just go back tomorrow and the next day, there will be appointments. And again, also some pediatricians' offices will have them, not all.
Wonderful, thank you so much. I also see a question that came in Spanish, thank you so much, about booster shots for the 12 to 18 group and for the younger age group. Are there going to be booster shots needed for children? Go ahead.
I can answer in Spanish, and I'm going to have to move because my computer's going to run out of battery. So, and my background is a little messy here.
There's live interpretation going, but go ahead.
Okay, then I can speak. That's fine. So at this point, we don't have any data yet on whether we're going to need boosters for children. Or whether we're going to need additional boosters for the entire population. But I would say that it's probably likely We just haven't really studied that yet. And whether we have annual boosters, I think is everyone's guess at this point. We don't know. It depends on whether the virus continues to circulate for the next several years, or whether we see it, somehow disappear magically, which I doubt. But the other thing is whether or not we develop enough immunity in the US and the world where we may not see much circulation, and we may decide to boost certain populations, but not others. It's really hard to know, but it's certainly a possibility that we might need annual boosters. But again, we'll have to see what happens over the next year or so. I don't know what you think, Marty. Yeah.
Well, I think it's important for people to realize that we're now, next month will be 1 year since we rolled out the adults. And so it took several months as we're studying these vaccines to see what levels of immunity are in the population. So we are now just recommending boosters because we have experience 6 to 8 months and more past the time when people finish that first series. So we are just starting the kids' shots. We just started the 12 to 17 in May. So we don't have as much experience yet. And so we'll know more as we move along in time. But certainly if you're an adult and you're 6 months past your primary series, then you should get a booster shot.
Great. Now we have some questions about specific conditions for children. Are there children for whom the vaccine is not appropriate? Special cases, or where people can find information out about that?
Yeah, so I think if I'm sure that Marty might be able to give you some local information, but if you look at the CDC website, if you just want to Google CDC COVID vaccine, you will find the website there. But there are very few reasons not to vaccinate people. One is if somebody is allergic to the components of the vaccine. And there are very few components to this vaccine. They're very simple vaccines. So that would be the same as for older people. The second is if they have recently had COVID, or if they have COVID right now, the recommendation for children is to just wait until their symptoms are gone and they're out of isolation, and then they can get vaccinated. And then the third reason for children and young adults is if they've recently had myocarditis, or an inflammation of the heart, they should wait. And there's guidance on how long they should wait before they would be considered for getting a COVID vaccine.
We've heard a lot from parents that are concerned about when you hear the word allergies. So we have the parents hear that, and then we hear lots of situations. What about my child who has peanut allergies? What about my child who has asthma? What about my child with seasonal? None of those really are contraindicated in getting the vaccine. So all of those children that have allergies to all of those other things, except for the very rare situation that Dr. Maldonado talked about components of the actual vaccine, they should be vaccinated.
Wonderful. Do any of the other panelists want to comment at all? Okay, we'll get to another question. Keep them coming. We're trying to get to as many as possible. Okay, here's a question. I have family members who have died from COVID after getting the COVID vaccines while testing positive for COVID. Not sure if they were vaccinated after or during the exposure. Do you recommend my child to get tested for COVID prior to getting the vaccine, just to be sure? It's a good question to kind of understand.
Yeah, we remember, I think it's already been said, but we have seen almost 200 million people in this country get vaccinated. Over 1 billion doses of these vaccines have been given around the world. And we have not seen any this issue of COVID infection and vaccine interacting in a bad way. So for example, we don't see that they make the reaction to the vaccine worse or result in complications. But we do know that just to be on the safe side, if somebody has active COVID infection right now, so if they're sick, they have a fever, and they have other symptoms of COVID disease, then they should wait until they're not sick anymore. And we say that for just about any disease. If we're vaccinating somebody for other diseases, we generally don't want them to have a fever or be sick because they might make their fever worse. But I wouldn't go out of my way to get a healthy looking child a COVID vaccine before they get, COVID test if they get, before they get vaccinated.
Yeah, I would agree with that. And there's no indication, no reason to go get a COVID test because, again, the vaccine benefits those that have not had COVID and also benefits those that have had COVID. Again, even boosting those immune levels even higher if you already were infected with a symptomatic or an asymptomatic case of COVID.
Great. Now, a question I'd like to hear from all of the panelists. A very smart attendee wrote in a question, with the coming holidays and more indoor events, what are the risks for young children who don't get the vaccine? So of course, we still have children 0 to 5 who can't get the vaccine. So what should we all be thinking about as a community in terms of preventive measures over the holidays? So Dr. Galvez, do you want to go first?
I think this is a very personal question, right? Because I think everybody's family is different. Everyone's culture is different. And there are varying degrees of people that are vaccinated and not vaccinated. And I think that's the part that is just very interesting as us as human beings, is you have to look at your family, whether you're vaccinated, and look at your other family members that may or may not be vaccinated. And then you have to make decisions, right? And so I think it really is a personal question of saying, hey, you're not vaccinated. I have a child that is under 4, has asthma, and I'm just worried about COVID with him, even though I know asthma is not a risk factor, but it could be. And so you're worried. And so you as a family could make that decision. You know what? I don't think we're gonna stay close again this year, right? And we're gonna spend our time with those that are vaccinated, essentially. And so, but I think that's a really hard question, because every one of us has family members that are vaccinated or may not have been vaccinated, right? And I know the levels are different in the Palo Alto and the Santa Clara County. It's a lot higher. But as soon as, we have families that have family members across the Bay Area, right? And it's very different, right? If you go to Sacramento, that's very different from to Fresno area, very different to the Bay Area. And so I think as you're visiting family, it's going to have to be a personal decision that you make as far as what risks. But the hope is with being vaccinated that your family would be and your child would be better protected. But again, it's, with close contact, with being indoors, those are all higher risks. And so you have to decide whether you want some family members to wear masks or not. And it may seem like we're past that point, but sometimes you're not. You may have to make a decision whether to spend time with some family members or not. The great part though, right, is that most of our older family members, most of the people that we knew were at higher risk, they're likely vaccinated. They likely are better protected. But I do think there is some, just as Dr. Maldonado presented, there are real risks with children getting COVID-19. And yes, they're back in class and getting vaccinated, or they're back in class and they're masked, right? And the risks are relatively low. It's still possible. But if you put yourself back into a pre-pandemic stage, we're still within the pandemic. And so you're going to have to choose with your family of how to best protect your family members.
Thank you so much, and for acknowledging the tough choices that families can face. I know I have a household where some of us were vaccinated and still others couldn't get vaccinated yet. And it can be a challenge. Yeshe, do you want to share what? Oh, I guess
I have a 1-year-old, I have a 2-year-old and a 4-year-old. They can just stay home, and then the rest of our family that's vaccinated can go. I'm just joking.
Just leave them at home. Okay, Yeshe, do you want to share what you would tell families with the holidays coming up?
Same thing as Dr. Galvez have said, get vaccinated, protect your family, your elders, and the children as well, so that you can be together. That would be one way of looking forward to it, is getting vaccinated and spending the holidays together.
Wonderful, thank you. Dr. Rogé?
Well, again, for the young children who are not vaccinated, probably, the risk for them is very, very small, even if they get exposed. But I think, as Dr. Galvez said, you have to think of who is at risk in your group. And again, the people who pay the highest price for from that pandemic are older people. The older you are, the more risky it is for you. And the second thing is underlying medical conditions. So if in your family you have very old people, if you have people who are older and have underlying medical condition, they are definitely at higher risk, especially if they are not vaccinated. So, that I would recommend for that type of family to be very, very cautious. The young children who are not vaccinated, the problem is that they may be carrying the virus and passing it around and no one knows they are sick, or they may just have the usual runny nose that, healthy kids get all the time. So, there is no way of knowing if they are going to bring it to the family. But I agree with Dr. Galvez, he has to be each family thinking of the people who are at risk and what's the best way to protect them.
Wonderful, thank you. Dr. Fenstersheib, what is the Public Health Department saying about holiday get-togethers?
Well, again, it's an amount of risk that you want to take. We don't live on an island, even though the Bay Area has some of the highest vaccination levels in the country, which is great. But we have a lot of people that come from all over the world into our area, so we don't have control of all of that. And then, of course, families do want to travel outside the area, so you may be leaving our protected bubble here. I think that's all important. Families have to look at the level of risk that they're willing to tolerate, realizing that if you're over 65, like was mentioned, probably a good time to get your booster, because we know those vaccine levels begin to drop. Get a flu shot. We're going to see more flu this year than we saw last year for sure. There was practically no flu last year. So that's one thing that you can do, and continue to practice all of those other social measures. It doesn't hurt to wash your hands. And if you're in a group where you don't necessarily have the ability to socially distance yourself, then put that mask on. So I think it's a lot of common sense issues, but we're in better shape than we were last year when we didn't have any vaccines at all. And for those kids that are getting vaccinated now, just remember it's two shots of the vaccine 3 weeks apart, and then another 2 weeks or so before you're fully vaccinated. So there is a time frame there that you're not totally protected after you go and get your first shot.
Thank you. There is a question, actually, I just saw that given the timing of the holidays, if my child can only get one dose before being with family, is this still risky since they've not received the full 2 doses? Go ahead.
Well, yeah. Again, for children, young children, yes, Dr. Maldonado mentioned there have been deaths and there have been things, but it's very, very rare. Most children really usually have a benign, in our experience, we serve mainly children. We have about 270 positive cases, and there were only 3 admissions and only 1 in the ICU. So most of the time, the children are going to have a mild illness, and it's not going to be an issue for them. But again, I think the main worry is people who are at risk surrounding them. And again, it's mainly the older people and people with underlying medical conditions.
Great. Yeah, I think like Dr. Fenstersheib was saying, we have to be smart about assessing the risks to our family members and to our children. And of course, 1 dose provides an increase in your immunity, but you're not fully immunized until you have 2 weeks past your 2nd dose. Dr. Maldonado, I want to ask you too what you think about the holidays and indoor events. And we have a question specifically about if children should continue to wear masks once they're vaccinated.
Yeah, I think at this point, first of all, we need to follow our county guidelines and our state guidelines around masking. And as you know, California has done a really good job. And as a result, we have a relatively lower hospitalization and death rate than many other states around the country. We also have reduced risk of school closures and outbreaks. And even though the risk is low, one death and 3 hospitalizations out of 270 is still 1%. I would say that that's a pretty good risk. If you had a 1% chance of your child dying, would you prevent it? Yes, I think I would. So I still think it's a pretty reasonable risk. We put kids in helmets and seatbelts for less risk than that. So I certainly, as a pediatrician, really want to make sure we understand that. And our Black and brown children are the ones who are getting hospitalized and dying. So in particular, so I think they are more likely to be in areas with higher rates of community transmission. So coming back to the issue of the holidays, I do think I agree that risk perception is critical. And, somebody might think 1% is not a big deal. But if we look at our overall track record for vaccinating kids, we vaccinate for lower risk, other lower risk diseases than that. But overall, it has improved our improved the risk of death and complications from other vaccine preventable diseases. And over the last century, we've doubled our lifespan, not necessarily because people live longer, that's part of it, but because we have reduced the number of under 5 deaths in this country. So I think it is a bigger picture risk perception than a case by case basis. But I also agree that we need to take our cultural context into account. So I would say that if families feel comfortable, even with unvaccinated family members, if those unvaccinated adults have a negative COVID test, for example, and have taken measures to be protected, I think families should be able to get together indoors. If people are all vaccinated, I don't see why, except for the little ones who maybe the under 5s or those 5 to 11 who haven't been able to get their full vaccines. And remember, as you said, we're actually scheduling our placebo recipients to get vaccines now, so they'll get their second dose right on Thanksgiving week, which means that it'll be 2 weeks after that. So the first week of December, they'll start to be protected, 90% protected against infection, symptomatic infection. So I think Thanksgiving might be a little, people might worry a little bit, but I think if most of the adults are vaccinated, and the children are, if everybody's healthy, I think those family members could safely think about getting together. And for Christmas, if the kids are 5 and older and everyone's vaccinated, there's no question that people could get together. I think with masking, as long as people are not symptomatic. And I should say, I don't know what you think, the rest of you think, but in general, if people have symptoms, whether they're COVID symptoms or not, we don't know that, right? Some of these people have flu-like illness and fevers. I don't think those people should be getting together with the rest of the family either, or anyway, because they can transmit flu and RSV to other people in the household. And I do agree that we're already seeing, I already saw a COVID RSV co-infected child this week in the hospital. So we're already going to see RSV. We saw an atypical season for RSV. And we're likely going to see flu as well. So we want to make sure that if people are sick at all, they should probably, unfortunately, stay home because they don't want to make themselves worse, but also not transmit to others.
And put a plug in for testing, too. Dr. Maldonado mentioned it. It is available. We have plenty of availability in this county. And then there are also those home tests, those antigen tests that really are very good. That you can quickly get a sense of whether you have enough virus to show a positive test, and most likely you might be likely to be communicable at that point if you're positive on an antigen test.
Wonderful. I think these are so important. And I just want to remind everybody there's no need to worry about whether you should wear a mask or not in public places, because we just have to follow our county guidelines and our state guidelines. And kids, even if they're vaccinated, they're still wearing masks in schools in Santa Clara County. So it's easy to know what to do. I'm going to ask a slightly different question, but I think it is a real issue. So we have a attendee who asked, my child has a lot of fear of getting the vaccine, the pain from the vaccine, especially because there's been so much in the news about it. Are clinics and providers and vaccine sites going to help with this? And I actually have two friends whose children have very severe fears of vaccines. And so I really do, my heart goes out. I know it can be a struggle for kids. Any advice? Perhaps Dr. Galvez, you have to deal with this for your patients. Any advice you give to patients about shots?
About how to not be fearful of it? Don't look. I think that's I think that hypes you up more, definitely. Any point of distraction is actually really important. So what you do, so I actually do it's called wide awake local only anesthesia for hand surgeries. So for finger fractures and things like that. And so the key thing is distraction. So typically I ask the child, like, what do you want to watch, on my phone, Netflix, Hulu, Disney Plus, HBO Max, I got it all. And so you just put it up and you have it in a way that, they can watch it and you can distract them. And I think, pinching something else besides where you're going to go in for administrating a shot helps. But some of it is going to be hard. I have my daughter's, she's scheduled to be vaccinated on Sunday. And because of her last set of shots, and she's going to turn 6, it was a disaster. She does not like shots. And my other, and it depends on the child, right? My son is like, go ahead, give me a shot because I want a lollipop. That's, son's good. But so my wife actually she's not going to hold her this time. And essentially I'm going to have to, hold her for the shot, but there's no way to convince her. We're going to tell her about it, of course, but you can also hype someone out of it, if that makes sense. So I think communication's good, but you only know your child, and only what's the best way to get them vaccinated. And so, but we're the adults, right? And that's why everybody's here. That's why all these families are here. We have to make decisions for our children. It's hard. But if you make that decision, you're going to have to, you're going to decide what way is best. But overall, I would say distraction is a really good form, whether it's using a phone for a show, and then also reward is another thing, right? Like a cookie or ice cream. I think that's probably on everyone's top favorite food for kids.
So screen time and candy, what we tell kids to avoid all the time, but if they get a shot, they can get all the good stuff. All right, we're coming to the end. I want to give everyone a last word. I'm so thankful that Dr. Maldonado brought up the health equity issue, that this is impacting our communities of color so much more than others. So perhaps a last word from each of the panelists about one thing we can do as a community to support health equity in our county, especially with the vaccine rollout. So Dr. Maldonado, last word.
I think we just need to be compassionate and kind to our communities. I think people are frightened. They're getting a lot of information. I think you almost have to have some kind of a graduate degree to understand all of this. And the fact that we toss these words around like immunogenicity on TV now, and when did we ever think that would happen? And I think for a lot of people, they don't understand. A lot of times we don't understand some of this. It's coming along as we're learning as we're going along. And so our communities are looking to us for advice and help. And sometimes we may think they don't understand or they don't have the capacity, and it's not that. I think there's just a lot of fear and uncertainty. So I think compassion and really seeking out and asking questions and listening to people's real concerns.
Thank you so much for saying that. We dubbed this a judgment-free zone at the beginning. This is our chance to ask questions, and we really want to help each of our community members get their questions answered. Dr. Fenstersheib, a last word?
Well, in public health, that's where we focus for the most part of the communities most impacted. And as I mentioned, our school program and our mobile clinics are going to the most impacted 80 schools first. So I think I would like people to understand that, be compassionate about that. And then, we're not going to get over this entire pandemic until every last one of us, no matter from what community you come from, is also receiving care and vaccine and the resources that perhaps a lot of other people take for granted. I think it's also very important in communities of color, especially, that they, as Dr. Galvez said, are seeing and hearing and listening to people that look exactly like them, have had the cultural experiences of them, and those that they can trust. And I think those messages coming from members within the community is crucial.
Thank you so much. I want to extend a really warm thank you to each of you panelists for spending the time here with us today. I want to thank the interpreters for talking as fast as you can. And I want to thank everybody from the Office of Community Engagement and from Stanford Video for helping us today. I think our next town hall is going to focus on long COVID. So if you have any ideas, send them our way. But we thank you for attending, and we'll see you next time. Bye.
Bye-bye.